Hey guys, so we're going to actually do the ear assessment next. When we do an ear assessment, we want to assess both of the ears bilaterally. We want to assess for alignment, skin condition, and also if there's any type of rashes or any deformity on each ear. Both her ears are in alignment. Her skin condition looks great. Her skin, reflects the same as her facial skin, so there's no redness or anything like that. So we'll just take a look on both sides. Next, we want to test for the tragus, if there's any type of tenderness or anything like that. Her tragus is actually pierced, but we'll just go on this side so we don't mess with that. So we'll just, palpate it, move it around, and it's non-tender for her, so that's normal. Next, we want to test the internal canal. So we'll look for the tympanic membrane, make sure it's pearl gray, there's no infections or perforations or anything like that. It's really important to look for perforations because then we'll need, a further assessment more in detail. So what we'll do is I'll actually come on this side. And we'll just kind of pull the back of the ear up and back. And look at her eardrum. That's good. So her eardrum is pearl gray. It's intact and it's normal findings. It's okay to have, the earwax or anything like that. That's actually a protective part of the ear. Next, we want to do the voice test, and what she'll do is I will whisper a word, in her ear. She'll take her finger and she'll actually just vibrate her tragus back and forth, and if she can repeat the word, then she's passed. So we'll just get her to do it on this side. She can just, do that. And I'll whisper in her ear just a random phrase. And then she has to repeat it.
Athens, Georgia.
Yeah. So that's just a way to do a voice test. We want to just, test their hearing or anything like that. Next, we'll do the Weber's test. With this test, you want to use a tuning fork. What we'll do is we'll put it midline here. And she can hear it bilaterally on both ears. Can you hear it? Okay. So that she's past that. You just want to put it on the top of the head right here. She'll hear the vibrations or that ringing noise in both ears, and that's passed. Next, we'll do the RIN test, and you'll also need a tuning fork for this as well. With this, you want to do it over a mastoid process bilaterally, and then we'll do it closer to the ear. The mastoid process tests for any type of conduction. In front of the ear, test for air conduction. So we'll just do it on this side. Can you hear that? Okay. One more time. Can you hear that? Okay. So those are just little key steps that you want to do during an ear assessment. Just a quick little ear assessment, always key to any type of complete health